When you're broken down and tired of living life on a merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out and move mountains. We gon' walk it out and move mountains.
Breast cancer doesn't discriminate. It doesn't care what color you are. It doesn't care what language you speak. And it doesn't care about your age, income, faith, or gender. But access to health insurance and affordable health care does discriminate. If you're under 40, insurance won't pay for a mammogram, even with a family history. If you need diagnostic testing, it's subject to deductibles, and nearly half of the insured pay high deductibles to reduce monthly premium expenses. And if you earn more than $16,612 a year, you make too much money to qualify for Medicaid. Now, if you're a legal immigrant, you're ineligible for Medicaid during the first 5 years of your legal residency. What about those who are ineligible for any type of insurance coverage? Early detection saves lives, but only for those who have access to testing and who can afford it.
So women who come in for a mammogram, usually we are the first step in determining if something is wrong in their breast. They first reach out to their primary care physician, they give them an order, they make an appointment, they come in to have a mammogram. And when the screening mammogram ends up showing something, they come back for a diagnostic workup. It's very important that women come in as soon as possible to have their mammogram. If this patient would have came in earlier and had her annual screening mammogram, we would not see advanced masses in women's breasts like this.
And we'll rise up, we'll rise like the day, we'll rise up, we'll rise unafraid, we'll rise up, and we'll do it 1,000 times again.
I'm Dr. Sandy Goldberg, co-founder of A Silver Lining Foundation. The foundation was born in 2002 after I had been diagnosed with breast cancer. And what I learned is that I was one of the lucky ones. I had access to everything that I needed during that journey. And I learned that other people, in fact most people, were not that fortunate. My husband and I were talking about what to do. And we decided we were going to start a foundation. And we started it at our kitchen table with one donation. And the programs of a foundation have grown over the course of these 17 years. Program number 1, the Chicagoland Cancer Information Coalition. Resource information and outreach. It's comprised of 24 participating organizations, some of which with a national footprint. Program number 2, Buy a Mom a Mammogram. That has evolved into so much more than a mammogram. We now fund all breast health testing, screenings through biopsies, for uninsured, underinsured, and undocumented women and men. An outgrowth of that, I always cry when I say this, the Evelyn Goldberg Mammography Center. The Mammography Center was renamed at UI Health in honor of my late mother, and that is the haven for those individuals receiving testing there. Program 4, Keep Abreast, a program designed specifically for young people. A multimedia presentation by a trained survivor, educating young people about breast health, the myths that are involved, about advocating for their own health, and going into their communities, their homes and communities, talking about what breast health testing and health advocacy actually means. And then Program 5, Survive to Thrive, which addresses the unique needs and specific testing requirements of those who have already been diagnosed with breast cancer. The women and men that we deal with at A Silver Lining Foundation feel that they don't matter. They feel that nobody cares. They feel that they are alone in the world. This is not the premise upon which our foundation is based. We turn no one away. So as we celebrate this evening, you've heard about what a Silver Lining Foundation does. What we need from you is to rise up, to help us make sure that no one goes unrecognized. And why? Because we feel everyone deserves a chance to survive.
And we'll rise up.